Hi, everyone. Thank you so much for joining us. I'm Dr. Maturu. I'm one of the adult epileptologists at Ohio State University, and I'm joined by my colleague, Dr. Twano, who's a pediatric epileptologist at Nationwide Children's Hospital. And together, we're going to be presenting the art of transitioning care from pediatrics to adulthood. So we have three learning objectives today. The first objective is to review barriers that exist with the transition of care process from the pediatric to adulthood. The next, we're going to discuss steps to bridge the gap of care within this transition. And our last objective will be to present to you our current transition model that exists between Nationwide Children's Hospital and Ohio State Wexner Medical Center. So what is the transition of care? The transition of care is defined as a planned and gradual move from a very family-centered, pediatric-oriented service to a more individualized, adult-oriented service. So for those of you who have already transferred your care, you know that at the pediatric epileptologist, a lot of the care is focused on family and making sure that you're reaching the goals not only of yourself, but of your family dynamics and your family household. And then as you transition to the adult service, we try really to focus on adulthood. So what makes you independent and how we can help you to succeed going forward. We really, in transition of care processes, strive to provide an uninterrupted and coordinated system that facilitates this transfer of care. And these two pieces are so important. We want it to be uninterrupted because we don't want there to be any gaps of care or gaps of anti-seizure medications that can lead to breakthrough seizures or increased emergency visits. And we also want it to be coordinated. We don't ever want you to feel like there's a lack of support in your care, and we always want you to be able to call on someone if you need us. And we traditionally think of transition of care as a process versus a single event, meaning it's not that the transition of care should happen just automatically or immediately in one single visit, but rather over months and years of planning and trying to get you very ready from a pediatric type process to an adulthood type event. So what is the right time to transition? In 1988, the right time to transition was felt to be at the age of 21, but this was revised in 2017 by the American Academy of Pediatrics. And they really discouraged a specific age. They felt that transition and transfer for different people were different for each individual. And that really depended on the patient and the family needs. And so you see on this page, I have the quote, "Everyone is unique and each experience is different." And that really stands true. Everyone's epilepsy is different, everyone's care is different, and that means every transition is going to be different as well. Why is transition of care important? Children with epilepsy make up 3.2% of the estimated 500,000 children with special medical needs who go from a pediatric to adult care model each year. So if you think about that, that's 16,000 people that need to be transferred from a pediatric model to an adult model. And that's why transition of care is so important. And that's also why it's so complex and also why we do it so gradually. So again, transition of care should never be done just kind of on the drop of a dime, but really we're trying to assure and make sure that you're transition ready throughout many months and years of your care. Poor transitioning can lead to poor follow-up. So of course, if you're not ready to transition, if there's no good transition plan in place, you might not actually make it from your adult or your pediatric epileptologist to your adult epileptologist. And that can really lead to a number of things. The first one is not taking your anti-seizure medications. So potentially if you don't have anyone to follow up, you might not have refills on your prescriptions, might stop taking your medications. And that can really lead to increased hospital visits and essentially more breakthrough seizures. And during this time, a lot of people stop engaging in their care. So if there's no support to get you through this transfer of care, it makes sense that you wouldn't feel as engaged in your care as you did previously. And when transitioning to adult care, it's really a crucial time to discuss several different factors. So the first one is educational achievement. What are your goals for high school? What are your goals for college? What do you see yourself doing in the future? It's a time where we talk about driving. So driving, of course, becomes kind of a big point of discussion as you go into your adulthood. And what does that look like when you have epilepsy? Can you drive? How long are the restrictions? Things like that. What are your goals for employment? So what do you want to do after you've reached your educational goals? And what does that look like with your epilepsy? What do you have in terms of FMLA or different leave options for your work to make sure that you're completely supported when you do have a seizure or something like that while you're working? What does it look like if you're sexually active? What contraception interacts with other anti-seizure medication? What contraception is good for you to use? Do you want kids in the future? And if you do want kids, what's the safest way to get pregnant and have a baby? A lot of times during this transition of care, we're talking about mood disorders. So anxiety and depression are really common with chronic conditions and especially with epilepsy. And so this is a crucial time that we're really discussing underlying mood disorders as well. And then a big point to talk about is just transitioning to independence. So maybe you were living with your mom or your dad or a family member, and now you're going to be transitioning to live alone or living with a roommate. And what does that look like in terms of your epilepsy? How can we tailor your seizure action plans to your type of epilepsy? So these are all really important to discuss and really important to discuss while you're transitioning to your adult care. Of course, there are many barriers to transitioning. On an own personal level, transitioning care from the pediatric to the adult world can create a lot of anxiety. And that makes a lot of sense. You know, you're used to seeing, your pediatric epileptologist for all your needs. They were able to start all these anti-seizure medications and have taken you such a long way. And then you're asked to switch providers to someone that really doesn't know you well. And so a lot of the transition of care is really just building up expectations. What should you expect in a visit when you're going to your adult providers? What information do you need to know to have on hand? And what can you relay to your adult provider that might decrease some of that anxiety that you have with switching care? And it's a hard time to transition because it's hard to be able to tell your own story versus relying on your family members during appointments. So, as you're growing up, it might be common for maybe mom or dad or a family member to really talk about your epilepsy story, how it all started, what medications you were on, how you felt with those medications. And now as you go to the adult world, all of those questions are directed to you. And that can be a really hard transition. And again, can lead to a lot of anxiety. There are, of course, barriers to transitioning from the family perspective. So in terms of your family members that's with you through all your appointments, it's hard to not be the primary person relaying the history and to really try to give you your independence and talk about your own history. And sometimes transition appointments as meeting sometimes anyone for the first time can just feel disorganized and really fragmented. Maybe the provider you're seeing doesn't know your entire history, so it's really just starting from scratch. Maybe that provider doesn't know all the studies that you've had, all the medications that you are on. And sometimes maybe you've talked about, the next step of your care with your pediatric epileptologist. So that when you see a new provider, that step isn't exactly known. So that can really create a lot of anxiety, and that can be a big barrier to transitioning care. And often when you're at your pediatric epileptologist, a lot of those models are very multidisciplinary, meaning you could be at that clinic visit and you could maybe expect to see genetics at that same visit, or neuropsychology, or the social worker. And as you move on to the adult care, you'll find that a lot of times you're just seeing the adult epileptologist, and we tend to make more referrals if we feel that you need a certain care treatment or a certain care plan. And so transitioning from a multidisciplinary model to an adult model with referrals can be really stressful as well. And finally, there are barriers to transitioning care from our perspective as well. So from a provider perspective, It can be really difficult for your pediatric epileptologist to transition care to an adult epileptologist. And the fear is that, you guys already have a treatment plan together. Maybe you're doing really well, or maybe you have steps to get you to do really well. And that potentially if there is a transition of care or a transfer of care, you might get worse. There's also a fear from the adult side that we may have difficulty providing care for difficult to treat epilepsy, or if you have seizures and a lot of underlying issues. And sometimes, and a lot of times, there's no formal transition process. And so this can create a lot of barriers between transferring care. And so the one thing that we really harp on when we transfer care is that collaborating in whatever way that you can do it is key, because that can really eliminate a lot of the anxiety and a lot of fear that goes into this. And I'm going to hand this over to Dr. Tuano for a little bit more about transitioning care.
Thank you, Sarita. We're going to try and get this to go back one slide. But as we start to think about the process of transitioning care, I will often think about it too as kind of having our young people learn to adult. And for all of the kind of barriers and the challenges that Dr. Machero has discussed, the question is, why is this so hard? Why is this so challenging? And when you step back and think about it, these teenage and young adult years, this is such a time of change for pretty much everything. And all of those features that are changing really are so significantly impacted by epilepsy and seizures. So when you're a teenager, the things that are important are your friends, you're going to school, you're thinking about work and getting jobs. All of those things are affected by your epilepsy. You have to think about other things. As she said, what happens if we have a seizure at our job? What do our friends know about our seizures and our epilepsy? It is a time where we want you to start to build independence, and a large part of that is driving. And some of the young adults I take care of are able to drive. Some of them, we do have some seizures, and so we need to help think about other ways that they can get where they want to go. Most teenagers don't want to spend more time at home. They don't necessarily want to be super closely supervised by their parents. If you have epilepsy, your parents are going to be checking up on you all the time. They're always going to want to know where you are. They want to know what you're doing. And it does affect where you live. If you're living with your family, if you're living with friends, if you're going to be able to move out and get a roommate, all of those things are impacted. You have to worry about things your friends don't have to think about. You need to make sure that you're taking your medications, you have extra appointments, and you need to keep your insurance. So some of your friends may be thinking about starting their own business. They're, that you want to open a gym or you want to be part of a startup. They may not need to keep their insurance, and you do. So you have other things that you need to think about. So as all of these things are changing in your life, then at the same time, we're also asking you to please think about changing to a new physician. So it really is a stressful time, and it makes sense that it is a difficult time. As Dr. Machero had said, epilepsy is more than just seizure. So we do need to think about not only having you learn to take care of your epilepsy, but also many of us have other medical concerns or things that go along with our epilepsy. So many of the young adults I take care of do have some learning difficulties. Anxiety is much more common than depression, but both are common in the young adults I take care of. ADHD is something that we need to be aware of and is more common. So we need to make sure that in addition to having a care plan to treat your epilepsy, that we also have something into place to help take care of the rest of your medical needs. About 1 in 5, so that's 20% of the young adults that I take care of also have autism. So we need to make sure that the care plans that we put in place also address any of the extra help or support that they need because of the fact that they do have the diagnosis of autism as well. So when we think about kind of long-term, we're talking a lot about transition and learning to adult and going to your adult doctor, but we also want to give you some of those skills to help make sure that you keep doing well. And so epilepsy, as you know, does have a lot of impact on your social life. And Epilepsy can make it harder sometimes to finish school. It can make it harder for you to get a job that you like, that you're excited about having. And a lot of people with epilepsy sometimes will say that they don't necessarily feel like they have as many close friends or as much support as some other people. And so those are things that as we get you ready to move into the adult world, we want to, think about if those are things that you feel like that is something that you worry about or you struggle with, and we need to figure out ways that we can help with that so that you keep doing well. Some of the young people that I take care of, we know that mood disorders need to be well treated because those can really affect your quality of life. If you have any sort of developmental disability or difficulties, we need to figure out how to make sure that you get enough support that you feel like you can do well. And then, if you do need help with every kind of day-to-day activities, then we need to figure out how to make sure that you can get all the extra support that you need so that you feel good about your transition process and your plan. So as we discussed, as a pediatric neurologist, we do sometimes have some things that make it a little bit harder. We're pediatricians, so we like taking care of you. We've been taking care of some of you since you were pretty little. So it's hard for us to kind of let go. Also, if your seizures are not well controlled, we kind of get nervous. We do want to kind of try and make sure that you're doing well before we have you change doctors. Some of us might not know a lot of the adult doctors. My hospital is a completely different place from Dr. Machero's hospital. So sometimes it takes us a little while for us to get to know somebody that we know will be kind of the right fit for the young adults that we take care of. And so those are some of the things that we worry about from our end as we kind of move through this process with you. And one of the things that has really become kind of obvious as people have looked into this transition process and getting kids ready to move to their adult doctor is that a lot of doctors don't really talk about how do we go through this process. So it was a while ago now, it was in 2016, they surveyed a bunch of kids and they just asked them 3 questions to see if anybody was talking with them about transition or talking with them about transferring to their adult doctor. They said, do you ever spend time alone with your doctor? Have you been told that you need to work on self-care? And did they tell you at any point that you might move to a new doctor? And any sort of medically like kids that we call medically complex, so kids that need more medical care, only about 17% of them had ever heard any of those questions. And even teenagers that they knew they were going to continue to need medicine and would continue to move on and probably need an adult epilepsy doctor, only 1/3 of them had ever had anybody ask like any of those questions or talk with them about any of that. So that's really on us. We need to do a better job of kind of letting you know that this is something that we need to think about and talk about and get ready for. But since you guys are listening to this talk, then you also know that if your doctor seems to be forgetting, you can like ask those questions and prompt them. So as we kind of move through this, the good thing is that the transition process and kind of learning to adult can help you not only get ready to take care of your epilepsy, but we also want you to feel good about moving into that next stage of your life. So how do we do this? Well, there's a lot of different ways that people are trying to help you get ready to move to the adult world. But there's a couple of things that are a pretty clear focus. First of all, we need to have those discussions. We need to start those discussions. Usually it's recommended around 12 or 14 years of age. And so that seems young, but remember, we're not doing everything all at once. Like Dr. Machero had said, this is a really ongoing process. So there are certain things that 12-year-olds can start to learn and start to take care of. And then the things that we ask them to help with can get, harder and harder as they start to mature. Every transition path is unique and it is tailored to you and what you need. So it takes into consideration, what kind of epilepsy do you have? Do you have other medical needs? What other things do we need to think about to make sure that you stay healthy? And what does independence look like for you? So as much as we're talking about kind of moving into the adult world and learning all these things, remember, there are no adults that completely take care of themselves. everybody has people that help them, that support them, that go to their doctor's offices with them, that give them rides, that drop off, milk and bread if they can't get to the grocery store. We all have people that help us, even when we're adults. And so everyone has a level of independence and a different kind of life that that gives them support, but also makes them feel like they're doing their best. And then we need to know who are your support people and who's going to be able to help you with these things as you go through this process. So one of the first things that we can do when you come to our clinic and we start to say that you're in this kind of, you're in that early teenage time where we can start to learn more about our epilepsy and take care of ourselves, is we can do the Transition Readiness Assessment Questionnaire, and we call it the TRAC. And this isn't all of the questions, but it kind of gives you an idea of what are the things that we want to talk about really over the next, 4, 5, 6, maybe 10 years that will help you feel like you're ready and help us feel like you are ready to take the best care of yourself. So we would want to talk about learning about your medicines. Do you know how to fill a prescription? Do you know which medicines you take and why do you take them? There's some questions about, do you know how to work with your medical team? So are you comfortable asking questions? Do you know how to call your doctor's office? If you get a test and you want to know the results, do you know how to reach out and get that information? So it's really important to learn about insurance, as we kind of talked about. So do you know about your insurance? Do you know how to get insurance if you lose coverage? And do you know what's in your plan or how to get information about that? We've talked a lot about independence. So are there stores? Do you know how to get groceries? Can you make your food? Do you know how to make a budget and take care of money? And then there's questions about epilepsy. So do you know why you have epilepsy? Do you have a seizure action plan? And do you know how drugs and alcohol might affect your seizure medications? And these are questions that we need to talk about. And remember, many of you may have been diagnosed with your seizures and epilepsy when you were young. You may have been 4 or 5 years old. And we spent a lot of time talking to your parents at that point, but not necessarily talking to you. And now that you are older and you can understand it, we need to kind of have those discussions again, so that the next time, if you come in and you say, you know what, I actually don't really know what kind of epilepsy I have or why I have seizures, then that's great. Let's talk about that. And then the next time when you come in, you answer these questions again, and that's a box that you can check that, yes, now you know that information. So these questions kind of help us get a sense of what you know, what you understand, and where you are, so that we can help make sure that that we talk about the things that we can help you with. This survey also does have an extra part. There is some extra information that young women with epilepsy, we want them to know about how their medicines and their seizures might affect pregnancy and fertility and birth control. So after you have taken all of those questions, then we look at those and we figure out, what is it that we want to talk about today? How is it that we want to move through and make sure that you are learning to take the best care of yourself? So why is this so important? Well, there is actually some good research that shows that going through transition education and the transition process really does benefit you as a young adult who's learning to take care of yourself. So people have said that after they've gone through this education process, they feel like they're more involved in their appointments. They know about their epilepsy. They feel better about taking care of themselves. And kind of, even though sometimes it can be frustrating or annoying, or some of the questions are embarrassing, after they go through it, then they realize that actually this was probably important, and they feel like they're ready to move to see their adult doctor, and they feel better about taking care of themselves. There's some research that shows that teenagers who sometimes if they ever have time where they can just talk to the doctor by themselves, or they do most of the talking at their appointment, it's actually shown that they seem to be more likely to remember to take their medicines, which I think is really interesting. They're more interested in their health care. And I don't think this is a surprise. If you're like alone with your doctor without your parents, you might be more likely to share like any kind of risky behaviors, or like, that you did have some drinks or something like that. I don't think that one is a surprise, but I think it is important, because we do want to know all of those things about you as your doctor to help you stay well. And then the other thing that is really important about helping young people feel better and more ready to transfer is some knowledge about insurance. So the going through this transition education process also really does help parents. And so at a time when we would kind of think that really the only thing that our teenagers really care about is their friends, it actually turns out that how parents and caregivers feel about transitioning and transferring to their adult doctor really is the biggest influence on how teenagers feel about this whole process. And so another interesting fact is kids actually prefer to learn a lot of their medical information from their parents, probably because they don't feel worried about asking questions. And kids that have a lot of talks with their parents about their medical care are also a little bit more likely to take their medication. So I think that's really important for us to know as parents that we can, when we get that education and we share that with our kids, that it's really important to help them keep doing well. And as you can imagine, if you go through this process and you kind of watch your child or teenager start to learn these things and start to maybe take some of that responsibility on gradually, as parents, it does make us less worried about them going into the adult world. And you and your doctor can kind of talk about, well, I think maybe we should try, they could take their own medications with a cell phone alarm, or, I'm going to help so that they can call and get their own refills. And you can kind of choose which pieces to work on as a team. And then after going through this whole process, a lot of parents feel a lot more comfortable with their kids moving into that adult world. So there are benefits to both you and your family for going through transition education. So in our clinic, our transition happens. It starts when kids are about 14. They get some information that says, like, these are the things we're going to start to talk about. This is what transition is. This is why it's important. And then we are very lucky. We at our hospital do have that multidisciplinary team that Dr. Matero had talked about. And so at your regular epilepsy appointments, after you've done your survey, then we have a team that can come in and they can help answer some of those questions. So, maybe you have questions about your medication. So I can talk to you as your doctor, but you could also talk to a pharmacist and learn from them. You have, if maybe you have some questions about whether or not your epilepsy can be handed on to your kids if you have a family. We have a genetics counselor that can help with that. Maybe your school classes have gotten a lot harder and we're not quite sure why. Well, we have a neuropsych doctor who's a learning and memory specialist that can sit down and help as far as thinking about what is how your classes are going now, and then maybe prepare for the future and think about what classes would be good classes for me to take, or what would be a job that I would like to have in the future and how do I prepare. So all of these people can kind of help take those steps to help you get ready. And then from our end, as a physician, very often families will say, well, my child sees 4 doctors here at Children's Hospital. What are we going to do? I'm only going to see adult neurology. And so from our end, that is where we start to talk to your other doctors and your team and find out, are you guys, were you planning to keep my patient here? Are you going to take care of them through their whole life? Do you guys take care of kids and adults? Or is this something where if you have a cardiology doctor, should we also coordinate so that all of your medical care goes over to the same adult doctors at the same time to see if that kind of helps with the whole process? Some of our kids that are very medically complex, we have a medicine and pediatric doctor team here. And so some of those kids, a lot of their medical care will stay here at Children's going forward. And so sometimes their epilepsy care goes over to OSU and the rest of their care stays here. If I need the help from an endocrinology doctor for diabetes or a heart doctor, I can place those referrals, and so those can all change at the same time. And then for our patients that have autism, we want to make sure that they're also linked to an adult autism center so that we can continue to meet their needs, because those we want to make sure that we have set up to be successful in all areas of our life.
And from an adult side, We are there to provide and help transfer your care over to Ohio State or over to the adult side. So typically what we do is an adult epilepsy provider from Ohio State comes to Nationwide Children's Hospital. We're really lucky to be a part of the multidisciplinary clinic at NCH for the day. And during that time, we're able to review all the notes and records from Nationwide Children's, and we're also able to talk to your provider often in real time and ask them questions about your care, or if there was any plans to change up your plan or anything that they really wanted to do or goals that you had talked about previously. And so during this first visit, it's very similar to a visit with your regular provider, except we start all the way from the beginning so we can hear your story. And so part of, transferring to adult care, I had mentioned, is really gearing the questions towards you now and trying to assess, what you know about your epilepsy history. Of course, anyone that's with you can help with your story, but it's kind of a nice way to start gathering all that information and starting from the beginning and trying to see what worked for your epilepsy and what didn't work for your epilepsy, and what your goals are for your own personal care. So a lot of the questions that we ask are, when did you have your first seizure? Do you have a warning sign before you have a seizure? How do other people say that your seizures look like? And how do they make you feel? So after you have a seizure, how are you feeling for the next few hours or days after you have a seizure? Do you remember what your workup was like? And if anyone said that anything was abnormal on it? Do you have any triggers? So does it seem like when you're very sleep deprived or you're extremely stressed, that's when you'll have a breakthrough seizure? Or do you have any risk factors? Meaning, do you have any family history of seizures? Did you have fever seizures when you were growing up? Were you born prematurely? Things like that. And then finally, what medications are you on and how do they make you feel? And then what medications have you tried in the past? Why did you stop them? How did they make you feel previously? And it's normal not to know all those answers. We, of course, have, all of the information in front of us because we are at Nationwide Children's, and we also have your family to help you along with your story. But it was really helpful for us and hopefully for you to really start at the beginning and kind of figure out what your seizure history looked like, where it is now, and where you want it to be. And so during that visit, we come up with a plan to help you stay seizure free or to get you to hopefully become seizure free, or really just to, achieve the goal that you wanted for your epilepsy. And we try to do that with the least amount of side effects possible. And as Dr. Tuano said, we also review your epi track. So, you'll be getting your epi track or that survey study or questionnaire throughout many of your appointments. And we get to see that at our own appointment, which is really nice because we get to see what you feel really comfortable with and what you don't feel as comfortable with. So she did a great kind of review of the questionnaire, but it talks about what type of epilepsy you have. Are you aware of what type of epilepsy you have? Do you know how your medications work? How your seizures can affect your school or your employment, how they affect your driving, how they affect bone health, contraception, future pregnancies. And so you're able to kind of give us some feedback. This is what I feel really comfortable with, and this is what I don't feel so comfortable with. And that visit's a great opportunity for us to close some of those gaps in care. Maybe we won't get it all done during that visit, but it really gives us thoughts and ideas for future visits too. Things that we can address pretty quickly and things that we just really need to work on and things that just are going to require a lot of communication. And then the one great thing about our transition clinic is that we make sure that you have a follow-up appointment at OSU prior to leaving, and then we give you all our contact information. So the one major barriers we talked about before to transition of care is kind of just being lost to follow-up. So maybe not really following up with your pediatric epileptologist, but not yet established with your adult epileptologist. And so through our clinic model, we really hope to kind of alleviate that gap of care. And essentially, the second that one of us sees you at Nationwide Children's Hospital, you're now we will see you on our OSU side, but before we see you on the OSU side, we will communicate about anything that happens there on out. And then at our first visit at OSU, it's kind of nice because that's actually our second visit, even though it's a new patient visit on the Ohio State side. And it's really maybe just a new place, but other than that, we know each other. We're kind of on the same page in terms of your care. We can just talk about your seizures and your epilepsy, your normal concerns, if we made any changes, how you're feeling about that. And it kind of makes for a smoother transition.
So our clinic is coming up on 2 years old at this point, and we've been really excited about it. Overall, there's been a really nice show rate at the clinic, which we are excited about. That means that that our young adults and their families are excited about transitioning. They want to get to know their new doctor, and they want to be able to move forward and keep and learn to take good care of themselves. So we had a lot of, we've had really good interest in our visits. One of our major goals was to make sure that everybody had an appointment when they left our clinic, so that you wouldn't be lost to follow up, and you kind of already had a plan. You weren't trying to figure out how to navigate a new phone system, those kinds of things. So 97% of our kids, or our young adults, I should say, had an appointment scheduled before they left, which was great. And we've had a really nice continuity. 91% of the young adults that went through our clinic came to OSU for their follow-up. And so we wanted to know if we really felt like this was something that was helping. And so we looked back at the past couple of years before we started our clinic, and only 65% of our young adults followed up in clinic after being transferred over to OSU before we had started this clinic process. So we really feel like it's been something that our families like, that our young adults like. We've usually been able to get most of them in to be seen in less than 6 months, which is a pretty common time to follow up. And I know from our side, our pediatric doctors are really happy to get to know our adult colleagues, and they have somebody that they're comfortable with, and they can talk to them personally to make sure that any plans or anything that they were worried about gets kind of carried forward. And so overall, we've been really excited about how it's been going, and we feel like our families have liked it, and we're hoping that we can continue. So kind of as we're closing up, so the things that we want you to think about kind of going forward are that transition is a long-term process. So the transition process is ongoing. It gets you ready for transfer, but it doesn't end when you transfer. You still are learning to take good care of yourself and learning about your epilepsy and your medical needs, even after you go to your new adult doctor. We do want you to start to hear about this at around 12 to 14 years. And as a young adult, you can lead the discussion with your doctor. You can ask the questions. You can tell them the things that you're worried about, or the things that you want to learn. During this time, we really want to focus on learning about epilepsy and learning to take care of yourself. And that's taking care of yourself in all areas: your medical care, your school, your social life, your independence, all of those things. We want to be able to help you with all of those things. And then the important thing to remember is every transition plan is really unique, and everybody's independence and adult life looks different. And so we want to make sure that we can do everything we can to help you get to where you would like to go and what your goals are, because even if you are not ready to adult today, we are hoping that we can get you ready to try to adult again tomorrow. Thank you guys so much for the opportunity to talk with you. Dr. Maturo and I are the ones that get to talk, but there is a lot of work and a lot of people that have helped to make our joint clinic a success, and we are really grateful to them. I am very grateful to our physicians, Dr. Maturo and Dr. Kandaker, who who have been taking excellent care of our young adults after they've transferred. It's really nice to have good, friendly faces, and we know that they're well taken care of. So we're very grateful to that as well. And so on here, you can see there's a QR code, and you can use that to submit a question. There is Dr. Machero and I and other specialists will be sitting in a panel, and we will be excited to answer any of your questions at that time on Saturday, March 19th. And thank you again for the opportunity to talk with you today. You guys have a good day.